Hello, you beautiful people. Good morning. Welcome back to it. It is your feel-good breakfast show, Expresso. We are live on SABC3. Thank you so much for choosing to start the day off with us on this beautiful day 7 of the lockdown and the coronavirus cases in South Africa. This is nothing to smile about. They have risen to 1,380 confirmed cases. Now, staying at home is essential to curbing the spread of COVID-19. And medical Doctor Michael Mol, he joins us via video call this morning to take us through why social distancing is so important, why we need to be paying attention and listening, the symptoms you need to be on the lookout for, as well as what the hotline Hello Doctor is all about. Dr. Michael Mol, good morning.
Good morning. How are you doing, man? Good to chat to you this morning.
Absolutely fantastic. All the better for seeing your face this morning on the screen. But Doctor, humans are social beings. We know this. We are all such social beings. So the idea of social distancing is something completely new to all of us, absolutely foreign. What is it and why is it so important in the midst of the coronavirus pandemic at the moment?
Well, it's a great question, and thank you for asking that, because it's a tough thing to deal with, as you said, as social beings. But the whole idea behind social distancing is to kind of separate people who have the virus, who are sick with the virus, from people who don't have the virus. It's as simple as that, and that's the way we flatten the curve and prevent transmission. Now, people often ask, but does social distancing work? And the answer is absolutely. In the Spanish flu 100 years ago, we know that cities that responded sooner had far fewer death rates, and applied social distancing than those who didn't. And if you fast forward that to today, cities in China that responded quicker than Wuhan did had far fewer hospitalizations. So social distancing, preventing the transmission of the disease really does work. And as hard as it is to stay at home and not go out, guys, you need to do that. Not for you, because most of us will survive the disease. It's for those who are at risk for getting the disease. That's who we want to avoid.
Just for the greater good of it all. But now, here we are. The country's finding itself in lockdown in an effort to stop the spread of the coronavirus. And of course, most of us, we're staying home. But Dr. Mol, just remind us again about the symptoms that we need to be looking out for, because there's a lot of confusion around this at the moment.
Yeah, and the confusion is largely this kind of infodemic that we've had, but a great question. So the major symptoms are a sudden onset of fever, that's anything over 38 degrees Celsius, a cough, people often say dry cough, it can be any kind of cough, a sore throat, tiredness, and difficulty in breathing or shortness of breath. So those are the symptoms, very similar to flu symptoms, similar to kind of the common cold, so hard to differentiate. If you get symptoms like that, don't rush off to the hospital. Don't go off to your doctor. Just call a doctor or get hold of someone that can speak to you, because what you don't want to do is obviously infect more people. And the most dangerous symptom you need to be looking out for in terms of when do I go and see a doctor is that shortness of breath. If you really start to struggle to breathe, that onset is quick with coronavirus. That's when you need to go and see someone.
Okay, so a lot of people are going to be taking to Dr. Google first and then going on to speak to their doctor. When would you say it's advisable to speak to Dr. Google first before seeing an actual doctor? Or should you actually just skip the Dr. Google and go straight to an actual real doctor?
Such a loaded question to ask that to a doctor. But I tell you what, Dr. Google knows a lot. All right, but it doesn't know you, and that's the big challenge. So, like I said, there's been an infodemic during this pandemic, this tidal wave of media coming down this pipeline to every home, and we don't know what to believe anymore. And the challenge with Dr. Google is so often it's a worst-case scenario. Type your symptoms in, and you're going to die. And as clever as AI is, and it is clever, what it doesn't have is the ability to reason. It doesn't have a doctor's diagnostic reasoning ability. In other words, a doctor will ask you about your circumstances, your physical health, your mental health, take into account all those factors, and then make a decision. Dr. Google can't do that. That's why it's so important to speak to a human being, another doctor who understands you, understands your environment, understands that you're South African and can deal with those issues. That's why I would say, if you are worried, speak to a doctor. Don't go to Dr. Google.
Oh, well put, Dr. Mol. Now, many people think that if they present the slightest symptoms, that they should head out to a hospital, which obviously overwhelms healthcare facilities, and we know that they are under immense pressure at the moment. We want to make sure that we use all these resources as smartly as possible. But you've come up with a free hotline service. It's called Hello Doctor, that will assist during this trying time. Please tell us more about Hello Doctor.
Well, thank you for the compliment. It sounds like I've come up with it. It's been around for quite a while, many years now. And the idea really is this, as you said, the challenge we have is that people who feel ill, who think they have coronavirus, are going to descend on our hospitals. And that means there are going to be far too many people there that don't need to be there. 85% of people who get coronavirus will have a mild disease and will be able to get through this at home. But if those people are rushing to the hospitals and the clinics in the neighborhoods, they're going to prevent people that need to be treated from getting treatment. And that's what we're trying to prevent. And so how can we tell someone who has no medical degree, just relax, you'll be fine, without giving them access to a doctor? So that's what Hello Doctor is all about. It's an absolutely free service, 24/7, anytime, anywhere, on any phone, in your pocket. And the idea is it's a USSD service. So in other words, you'd go through a little bit of a screening test, asks you a couple of questions to determine if you are at risk for corona. If you are at risk, a doctor's going to call you back and engage with you and apply that diagnostic reasoning we spoke about earlier and let you know if you are at risk or not, and then help you manage that condition. Because a lot of the time, our doctors are saying, you don't need to go to a hospital. You really just need to manage this at home, a lot of bed rest, a lot of fluid, some paracetamol, Panado if you've got, but please don't panic. And that's the idea behind Hello Doctor. And it's aimed at our lesser privileged communities. So it's the USSD is absolutely free. You don't need any airtime. You don't need any data. You can use any phone, a basic feature phone if you have. That won't exclude you from access to these doctors. It's 24/7. We've got a whole bunch of volunteer doctors that have volunteered their time and are ready to give you a call back. So that's the idea. It's just anytime, anywhere, immediate access to a doctor to answer your questions and your concerns around coronavirus. And most importantly, give you reassurance.
I love this.
We need to manage this disease at home, not in our hospital.
We need to manage this at home and not in our hospitals. And I know we have such pressure right now with test kits, so we want to make sure that we use all of those sparingly. But thank you so much, Dr. Michael Mol, for making time to chat to us this morning. I have to say before I let you go, you look absolutely amazing this morning. At home. I mean, can you imagine? Can you cope with this?
It has to be the lighting.
And there's so much love for you.
That's
Thank you
what it
so
is.
much for that. Of course, all of that information is available on hellodoctor.co.za. And for more information about the coronavirus, you can go on www.sacoronavirus.co.za. That Hello Doctor USSID rather is *120*394#. Make sure you use this facility. There are so many medical professionals who've taken their time and volunteered their time, their skill, and their expertise to be able that they're able to intervene and help all of us during this tough time.